Good evening. My name is Caroline Jiguna, and today we're going to talk about male genitourinary disorders. The types of disorders we're going to discuss today are erectile dysfunction, prostate cancer, benign prostate hypertrophy. We're going to begin with erectile dysfunction. Erectile dysfunction is the inability to keep or get an erection that is hard enough for sex. What causes this is when you do not have enough or good blood flow to the damaged nerves to the pelvis. Some of the causes that can cause the blood flow to be limited to the pelvis area and cause you to have the erectile dysfunction are high blood pressure, diabetes, depression and anxiety, advanced age, heart disease, recreation drug use, smoking, and the side effects of some medicines that you take for blood pressure or antidepressants. What are the treatment options for the erectile dysfunction? Your doctor may recommend psychotherapy. You may also have a penile prosthesis inserted. They also put a vacuum constricted device to the pelvis to improve blood flow. Most important for you to find a healthcare provider that you can freely talk about the symptoms you're experiencing. Do not stop taking any medications without discussing with your doctor. Next, we're going to talk about prostate cancer. Now, we're going to start by defining what the prostate is. The prostate is part of the male reproductive system. There's a picture that shows you where it is. It weighs about the size of a walnut. It weighs about an ounce. It's the cancer that occurs in the prostate area. Now, it's very important to know that most tumors grow very slowly. Now, there are no known causes of prostate cancer like all the other cancers we know, but there are risk factors that may make you prone to the cancer, such as age. This increases rapidly after 40. Race. It occurs more in African American male and Caribbean male than in Caucasian. Obesity. Smoking. Other risk factors are sexually transmitted disease, geographical factors. It's more common in North America. There are studies that have shown that having a vasectomy could increase your chances. The inflammation to that prostate area, having a family history, having some gene changes in your body, and having a diet that is high in fat. The signs and symptoms of prostate cancer include painful urination, blood in the urine, starting to urinate then stopping, going to urinate more frequently, waking up multiple times at night to urinate, blood in the urine. Now, it's very important to discuss all this with your doctor, as it may not necessarily mean you have prostate cancer. It may mean you have something else. So giving the doctor a clear account of what you're experiencing will be very helpful in diagnosing what you have. Some treatment options your doctor may suggest: surgery, radiation, hormone therapy, chemotherapy, watchful waiting. Now, watchful waiting is where, because especially in older men, the prostate cancer advances very slowly. So sometimes the doctor will just keep an eye and treat the symptoms, not pursue any aggressive treatment because the cancer is not growing rapidly enough to cause you any harm. So it's very important to discuss everything with the doctor. Now, like I said before, it's important to discuss all symptoms with the doctor. It's important to have your prostate cancer screening at age 50. Reduce your risk factors by making lifestyle changes such as stop smoking, cutting down on a diet high in fat. Discuss all treatment options with your doctor and discuss if watchful waiting is an ideal treatment for you. Next, we're going to talk about benign prostate hypertrophy. This is a condition in men where the prostate gland is enlarged, but it's not cancerous. As a result of the prostate gland being enlarged, the man finds it difficult to pass urine. You see, the first picture shows a normal prostate. There's a lining, there's a space in the middle where the urethra, where the urine can flow. But on an enlarged prostate, it's blocked, and the passage becomes tiny, making it difficult for a man to pass urine. Now, what are some of the risk factors? A man over 40 years, having a family history, having erectile dysfunction, lack of physical exercise, obesity, heart disease, type 2 diabetes. The symptoms that our patient will experience is having urinary accidents, waking up at night to urinate more frequently, accidental loss of urine, having strong smelly urine, a very weak urine stream, trouble to start urinating, the inability to delay urination, you're not able to hold, that causes the accident, pain after ejaculation, pain after urination. What are the treatments? Okay, the doctor may work with you having lifestyle changes, reduce intake of fluids before bed to avoid the symptoms, exercising your pelvic muscles, avoiding alcohol and carbonated drinks. There are medications which are used to stop or shrink the growth of the prostate. The first kind are alpha blockers. What these medications do, they relax the muscles of the prostate and the bladder. So they improve the urine flow and they reduce the blockage. For example, Flomax. Another type of medications that block the production of a gland which accumulates in the prostate and may cause prostate growth. For example, Prosca. The doctor may also suggest some minimally invasive procedures. These are done they can be done in the doctor's office. There's the transurethral needle ablation. The doctor may insert a needle in your urethra to open up. Transurethral microwave thermotherapy, high intensity ultrasound, water-induced thermotherapy, prostatic stent insertion. Now, these procedures are done in the doctor's office, and the main goal is for the doctor to insert an instrument that will widen the canal without necessarily having you go major surgery, and reduces, the effects of after the surgery. Now, when all other treatments and medication fail, the doctor may recommend surgery to remove the obstructive prostate. Example, the most common one is called the TAP, transurethral resection of the prostate. They insert an instrument in the prostate to break down the prostate and remove it. Another one is the laser surgery, where they use laser to break down the prostate. Another one, open prostatectomy, where they open it up and take out the prostate, transurethral incision of the prostate, where they insert an incision to the prostate and remove it. Now, it's very important to discuss all the symptoms with your doctor. Get a prostate checkup at age 50 and every year. Comply with your dietary and lifestyle instruction, and discuss all medications you take with your doctor. Now, here are the references attached. Keep in mind that this information is not meant to substitute or take place what your doctor tells you. You still need to discuss all symptoms with the doctor, and even small things that maybe going to the bathroom frequently at night, there may be a treatment for that. So it's very important to discuss all these things with the doctor during your physical. Thank you.